Hello, everyone. Well, hope everyone is enjoying their Monday and President's Day. We are talking about persistent depression today and how can naturopathy help in understanding the root cause. We have Dr. Coppola with us. Dr. Coppola is a naturopathic doctor, certified nutrition specialist. She's doing a postgraduate in homeopathy, oncology, and a personal trainer. She's all in one, integrative medicine specialist. Thank you so much. I'm so glad that you're here with us, Dr. Coppola.
Thank you for inviting me, Amita. I am honored to be here. Yes, thank you.
So let's just understand when we use the word persistent depression, what does it mean and what is the root cause of that?
So when we're talking about depression, there are different diagnosable types of depression. You can have acute depression that is specific to something that's happening in the moment. We all experience this as we're going through our lives. We have things that upset us, that make us feel depressed. And then we can have chronic depression. And chronic depression, it usually is maintained for 6 months or more. And there's specific factors that need to be set in place that can diagnose chronic depression. Somebody who's experiencing persistent depression, and this is probably a topic that's coming up for a lot of people now with what our world is going through, because we've had a lot of time in isolation, time alone, and it's just it kind of like it brings the blues on. And persistent depression is when we're experiencing these chronic symptoms for 2 or more years. So over 2 years, you have to have these symptoms. And so right now we're rounding the bend of that like almost 2-year mark when like COVID really set in. And so now is a time if we've really been feeling these depressive symptoms, the irritable mood, just depressed, run down, poor appetite, possibly overeating, insomnia, or hypersomnia, if it can go either way, either low energy, low self-esteem, poor cognition, poor decision-making, and feelings of hopelessness. When we've now been experiencing these throughout like this possible entire COVID, at least 2 years or more, then that's when we can potentially get a diagnosis of persistent depression. The other thing that goes into this diagnosis is that you can't have 2 months in which you were feeling okay. So if during those 2 years you've had like 3 or 4 months that you're feeling fine, it kind of negates that persistent depression. And you can just be like kind of bouncing back and forth between like chronic depression, possibly a little bit manic, depending on what the person is experiencing.
Okay.
So, and then you asked about causes.
Yes, please.
Yes. So persistent depression, just like the other forms of depression, can be caused by a situational. So just like in the acute situational depression, excuse me, persistent depression can be caused by something that is situational, that lasts. It can be caused by a trauma when we're young. It can be caused by a trauma when we're an adult. It can be caused by our genetics. It can be caused by neurotransmitters that we are or are not producing. It can be caused by our diet, eating food that's not good for us, just creating that lifestyle of sedentary lifestyle can kind of set in that persistent depression. There are epigenetics that can cause it. So the foods that we eat can turn on and off our genes, causing us to feel a little bit more depressed and prolonged depression. There's a lot of different factors that go into play. So finding what is going to work for the individual, we really need to find the cause behind each person's different depression.
Okay, so this is very complicated, right?
Yes.
Understanding the cause. And so what do you do? Like, do you have a very lengthy kind of a questionnaire when someone says, I am depressed? How does the process work?
So it's going to, there's a very lengthy questionnaire. And when you're coming in for a naturopathic medical treatment or medical care, you're going to go through all of your symptoms, your current symptoms, what brought you to be feeling depressed, but you're also going to go through your past history, anything in your health history that happened when you were a child, anything that happened in your family history. You're going to go through a review of systems to see if any of the major organ systems are correlating to what's causing the depression within the individual. And it usually will take anywhere between 90 minutes and 2 hours. It's a very thorough intake. In there, we'll go over labs, we'll go over blood work to see if there is anything physiologically that we can see on these labs that's indicating a cause for the depression.
Okay, so this is not a medical advice. I just want to put a big disclaimer here.
Yes.
This depression is a very serious
Hmm.
issue, but
Absolutely.
we do want to give hope, and we want to understand if naturopathic medicine can help wean off, or even the diet and lifestyle modification can at least help reduce some of the medication that people might be taking who are depressed.
Yes. So when we're talking naturopathy, we're talking nutrition, we're talking exercise, supplementations, homeopathy, they can all help somebody to improve their overall feelings of well-being, can help to improve the vitality, help to improve the energy within us. And depending on where the person is and what other tools they're using. So depression is very multifactorial. And in order to really help somebody heal, you need a team, and you need your like primary care person, whether you decide it's a medical doctor or a naturopathic physician or a holistic healer, whatever your primary care person is, you need that person on your team. When you're dealing with depression, you also want to get somebody who is going to bring in a counseling aspect as well. So you want to get in somebody that is doing positive, like cognitive behavioral therapy, integrative family systems, some form of talk therapy. And you also want to pull in your own self discovery as well, doing your own meditation, your own mind body care. And with the weaning off of medications, we want to work with the medical doctors. We always want them on board with us because they're the ones that have prescribed these medications. And we want to make sure that the weaning process is going appropriately, because depending on the medication is altering how long some neurotransmitters are available to the brain. And so we want to make sure that as we're pulling those medications out, the person is not experiencing any adverse side effects. They are following whatever their medical doctor is saying as well. So it's not just like a one care team. Like, you want everybody on board. And yes, naturopathy and naturopathic and holistic care can absolutely help people feel better and can help people to ultimately wean off the medications. We want to make sure that everybody has all their physicians involved, and that as you're doing the wean off process, you are pulling in all of these other healthy self-care things. You're pulling in the right nutrition. You're pulling in exercise. Exercise has been shown to be one of the number one things to help combat depression. And it doesn't have to be going out and doing like a 60-minute hit workout. Just going for a walk, going for a simple walk in nature, connecting again with nature really helps us through these times when we're feeling blue. Pulling ourselves back into just walking in the forest or walking on the beach. It can do amazing things for when we're feeling down and we're feeling blue. And with naturopathy, we pull in botanical medicines, we pull in homeopathy. Some naturopaths even pull in some acupuncture depending on how they practice. One thing that I love doing is hydrotherapy. Hydrotherapy is amazing for our like mental well-being. You can use constitutional hydrotherapy, which you can do in an office. You can do cold contrast showers, which is something that we can do simply at home, and just ending the shower on cold helps to boost our vitality, helps to boost our energy. And all of this can go into the package that's helping us to reduce our medication load as well.
So when you talk about the hydrotherapy, you think like simple things like swimming, or maybe going in some kind of a jacuzzi. You think that would also help? I'm just thinking because that is
Yes.
a
So going in a hot tub is like a form of hydrotherapy and can help when we want to kind of improve like our vitality, when we want to increase our vitality. Cold contrast is really what helps our body do that. So when we do constitutional hydrotherapy, we have a person on a bed and we put warm, wet towels on them and then flip them with cold towels to get the body to acclimate to the contrast. And what that does is it changes how the blood is flowing in the body. So it's pumping the blood systemically through the body, pumping the lymph systemically through the body, and helps to vitalize all of those organs, get all of those white blood cells going, and just gets that energy going. So yes, going swimming is amazing. Getting in the hot tub is nice and relaxing. We want to, when we're feeling especially depressed, we want to vitalize the body. We want to like wake it up a little bit. So one thing we can do at home is we can do cold contrast showers. So you take your shower, and then for the last like 20 seconds, you turn the water cold and you just kind of like let it run on you cold for about 20 seconds. Now, what you're going to do is you're going to start as cold as you can handle and then slowly increase at each shower until you have this contrast of the really hot shower and like a really cold 20 seconds. And that's going to really wake you up and energize you and get your blood moving and get you ready for that day.
Wow, that's amazing. So, could you, since you are a certified nutritional specialist, I have to ask this question before I wrap up. Any particular type of nutrition that people who are depressed should focus on? Any particular type of food groups, nuts, or anything that you can recommend?
So a lot of times when we're feeling run down and we're feeling blue, one of the first things that our brain thinks of is carbohydrates. Get the sugar, get the candy, get the chocolate, get those carbs in. And there's a reason for this, because when we're feeling down, our brain wants the precursors that are going to make our serotonin and help make us happy. And carbohydrates, when we get in carbs, we actually allow our brain to get in more of the precursors, even though it's not from the carbs, it's in the actual carrier molecules. And so that's why we crave carbs. Now, in the long run, going to carbohydrates when we're feeling down and we're feeling blue is going to have a potential negative effect. We can, depending on how much we're eating, it can go into other issues like diabetes and stuff like that, heart disease and all those things. So what we want to do, it is always best to get as much food as you can from whole sources. Get your food as close to the natural source as possible. Focus on eating a lot of vegetables, at least 2 servings at every single meal, so you're getting all of those phytonutrients. If we're eating animal products, and protein is important for our brain health, and it's important for making our neurotransmitters, and it's important to make sure that we have these precursors for our happiness neurotransmitters. If we choose to eat animal protein, it's important to get it from an organic grass-fed source, because the factory farm meats that we have are really subpar and they're doing us a lot of harm. And then one thing that we really, really need is a good omega-3, because we don't get enough in our diets. So our brains are depleted from omega-3s and we're going into elevated inflammatory modes because we have too many omega-6s. So eating more like wild caught salmon, even taking omega-3s will help to like rebalance that so we can reduce the inflammation. And omega-3s are what surrounds our neurons. It helps us send these signals that we need. And so that's really important. So I would focus on getting whole healthy food, at least 2 servings of different vegetables each meal, getting omega-3s in the diet, and focusing on, if we're eating animal products, to get them grass-fed and organic when possible.
And no, I think that those are great suggestions. And even homeopathy has had quite a bit of research, right, that helps with the. Do you want to comment before on that?
So homeopathy is amazing. It's a beautiful medicine that uses very minute amounts of the medicine to treat. And with a homeopathic intake, we're taking the intake as the patient feels and experiences their illness or whatever they're going through. And we use that to determine which homeopathic remedy is going to be best for them. And so one of the reasons I love homeopathy is because you get to hear the patient's story for how they're experiencing it. And that's the most important thing, because they're the one that's going through it. And there are many different remedies for people who are experiencing depression. but they all differ in how people can experience the depression. So some people may have, depressive thoughts that are constantly circulating in their head. Some people may have they're just like melancholy, they're just like run down. Some might have the fears of dying. Like there's so many different ways that we can experience depression, and knowing our patient's story and how they experience it allows us to give them the appropriate remedy for them.
All right. Well, thank you so much. This is an amazing information that you've shared and given hope to millions of people out there who are, feeling depressed and more so because of the COVID-19. There
Yeah,
is hope, and that's what we are advocating here, is that showing all of you, hope, including us, that holistic lifestyle can help lead a better life as far as mind and body is concerned, right? Anything else you'd like to add before I wrap up?
absolutely. Absolutely. I want to say thank you for giving me this opportunity. And there is so much that we can do for our health. And we have more power in our health than we realize. We do. And it's in the small decisions every day: what we eat, how we move, how we sleep. And it's amazing the impact that we can have over our health. We really have so much power in our health. Yeah.
That's right. Well, thank you so much. Everyone, keep supporting us. We are over 200,000 followers, and we are launching workshops. We're launching free videos. So stay tuned and have a good evening. Bye-bye. Thank
Have a good
you.
night. Thank you.